So yes, to actually hear Arabic, you would have to select Korean. Sorry about that. No way around it for now. So can the Arabic interpreters activate their microphone and try to speak? I can hear you clearly. Okay, I can hear you clearly. I can hear you just fine. Thank you very much. Okay, so we are ready to start, I think, in around 3 minutes to be on time.
Thank you. Does Mary have to make an announcement just to tell people to select the different languages? After she makes that announcement, are you going to make the announcement in French?
I'll do it in French after she makes it here.
Okay, and then Ines, do you want to say that in Arabic?
Sure, I can make a very quick announcement telling them that if they want Arabic translation, to select Korean.
Okay,
thank you.
Yes.
Yeah, well.
If they can understand me in Arabic.
Thanks. So you'll be the first one to speak. So I'll do like 5, 4, 3, 2, 1.
Okay, so I did send. Okay. The questions are they sending it to the chat or to the Q&A?
That's right. Just do the questions that we've discussed, and then extra questions, we'll send it to that. So 2 minutes to showtime, I think. Okay, so 5, 4, 3, 2, 1. Over to you, Mary. You have to unmute. You have to unmute.
Hello, good morning. I'm Dr. Mary Stephen from WHO Afro. Welcome to the media briefing on COVID-19. This media briefing is being organized in collaboration with the APO group. So today we'll be looking at the pandemic as it evolves in Africa while we are approaching the 1 million cases. So we are joined today by the WHO Regional Director for Africa, Dr. Mashidisho Moeti, and the Regional Director for Eastern Mediterranean in Cairo, Egypt, Dr. Ahmed Al-Mandari. So we are going to hear opening remarks from both regional directors, after which we will open up for questions. We also have Dr. Michel Yao, who is joining this press conference, and he will be available to answer our questions. We have interpretation in English, French, and Arabic. So if you go down to the Zoom, you will see a symbol for the globe. That's where the interpretation is. Select the appropriate language. For the Arabic interpretation, please click on Korean. So right now, let's turn to Dr. Matshidiso Moeti, the Regional Director for Africa. Please tell us about the milestone we are approaching.
So, good afternoon, and thank you to all the journalists and members of the public for joining us for this press conference. I'm very pleased to be joined today by my dear colleague, Dr. Ahmed Al-Mandari, who is the Regional Director of WHO for the Eastern Mediterranean region. Together, we are responsible for WHO's work in the 54 countries of the African continent. We want to reiterate the urgent need for international solidarity in support of African countries, both to respond to the COVID-19 and to address the broader socioeconomic consequences of this crisis. Today marks 6 months since WHO declared the novel coronavirus a public health emergency of international concern. At that time, there were no confirmed cases in Africa. Now, there are almost 890,000 reported cases, and about 18,000 people have lost their lives to COVID-19 on the continent. In the coming week, cases are projected to pass the 1 million mark. As this critical signpost approaches, governments, partners, and communities must work together to suppress COVID-19 transmission and mitigate the impacts of this pandemic on individuals, families, households, and economies. In the past 25 days, cases have doubled. South Africa continues to account for the majority of cases, but the rate of increase has slowed, with fewer new cases reported in the past 7 days than in the previous week. However, in over 20 African countries, including Ethiopia, Kenya, and Madagascar, there were more new cases in the past 7 days than in the previous week. We are seeing in Africa and other parts of the world that when measures to suppress COVID-19 transmission are eased, cases creep up. So it's important that authorities and all communities have the capacities in place to react quickly and comprehensively with strong surveillance, testing, isolation, and contact tracing. These are the key strategies that need to be in place. As we adjust together to this new normal, I ask that governments, partners, and communities globally keep in mind that no one is safe until we are all safe. It's imperative that with international solidarity, we focus on equity and serving the most vulnerable among us. In closing, I'd like to wish all our Muslim brothers and sisters celebrating tomorrow, Eid Mubarak. I look forward to our discussion. And again, it's a great pleasure to be with you, Ahmed. And thank you all very much for having joined us today. Thank you.
Thank you, Dr. Moeti. So as we are approaching Eid, as Dr. Moeti has just said, we would like to ask Dr. Al-Mandari, please tell us how people should protect themselves during this Eid, and also the impact of easing lockdowns on the COVID-19 response.
Thank you very much for the introduction, and thank you, Moeti, for giving me the chance to join you in this important briefing and press conference. I wish you all a very happy Eid holiday to all citizens in Afro and other Muslim countries. So thank you again for giving me the chance. I mean, what shall I say? I mean, you have just covered all of the essential elements in such a press release, Moeti, and touching base on important elements when it comes into dealing with this COVID-19. but I just have few remarks to add, to mark the grim milestone of our approach toward 1 million cases of COVID-19 in Afro. As we approach the Eid al-Adha feast, there is increased risk of transmission as a result of social and religious gatherings. We saw this happening a few months ago, as you all know, just after Ramadan and Eid al-Fitr in May, which led to a spike in cases in June. As a result of that, we approached Eid al-Adha with concern and call for increased vigilance by both countries as well as communities. WHO recommends the cancellation of social and religious gatherings related to Eid al-Adha, but any decision should be based on a standardized risk assessment and should be part of a comprehensive approach taken by authorities to respond to the pandemic. WHO recently released guidance to countries and communities on public health measures for Eid al-Adha in the context of COVID-19. 6 months ago, or 6 months into the pandemic itself, the proven public health measures that are remaining, the central part to the response of COVID-19 have not changed. It is still the same. And that have seen countries succeeded in controlling COVID-19 by implementing these measures. For countries, these included testing of suspected cases, isolation of all cases, protection of healthcare workers, quarantine and tracing of contacts, and proper management of points of entries. If done effectively and efficiently at the right time and scale, these interventions can break the chains of transmission and stop the disease from spreading. For the public, life-saving personal protective measures include hand washing, respiratory hygiene, social distancing, and wearing of masks. The actions of one individual, as you said, Mayuti, can affect the course of the pandemic in any country and even beyond. Many countries have opened borders recently and are easing social measures because of their significant economic as well as social impacts. If the restrictions are not lifted in phased approach with proper epidemiological, healthcare, and public health assessment, there is a risk of resurgence of disease activity. As a result, we are extremely concerned about the risk of further spread of COVID-19 in Africa and beyond if countries fail to sustain effective public health response. Countries that have been most successful in tackling the pandemic so far have all demonstrated strong governmental leadership, political cooperation, and close collaboration among relevant sectors. Avoiding politicization of this public health crisis allows us to focus our collective energies on what really works in controlling the disease. Unfortunately, misinformation, misunderstanding, fear, and panic continue to contribute to the spread of the disease and undermine people's abilities to make informed decisions. When communicating with their population, governments must be clear, truthful, transparent, and compassionate. We all know by now the measures that need to be taken to protect ourselves and our communities. Let us remember that every action we take as individuals in the coming weeks can determine the course of the pandemic in Africa and beyond. Finally, let me convey my warmest wishes to you all as we approach one of the most important Muslim holidays. While we are all burdened by the COVID-19 outbreak, the festive season presents us an opportunity to reflect on blessings we all have, which always more numerous than our trials. Eid Mubarak to you all, and thank you very much, Mayuti and colleagues, for giving me the chance to join you in this important press conference. Thank you.
Thank you, Dr. Almandari. So we have heard from our two panelists. So it's your time to ask your questions. Please go to the Q&A and post your questions there. As we said earlier, we also have Dr. Michelle Yao online. He will be happy to answer questions as well. So our first question goes to you, Dr. Moeti. The first question is from Elizabeth Mera from Daily Nation. Now that we are approaching 1 million cases, is the continent the next hotspot in the world? And is the healthcare system now better prepared to deal with the rapidly rising cases? Over to you, Dr. Moeti.
Yes, okay, good question. I think I'll start by saying that, Africa is not one country. As we've said, it is 54 countries, and the dynamics in each of the countries are different. So it's difficult to anticipate on a continental basis what is going on. And we're seeing a lot of diversity in the degree to which countries are affected on the continent. Overall, the pandemic is increasing, let's say, and is accelerating if we take a continental look. But we also see that about 5 countries account for 75% of the cumulative COVID-19 cases on the continent. And 1 country, South Africa, accounts for about almost 65% of these. So we have, I think, a situation which is very diverse, with rapid growth definitely in South Africa, growth in some countries, which is faster in the last couple of weeks than it has been in, say, about a month ago. And this includes countries like Kenya, like Madagascar. The situation continues to grow in countries like Nigeria. And then we have a few countries, I think I must say, where we have seen that the rate of growth has been very slow from the beginning and has been sustained like that. Countries like Uganda, the Seychelles and Mauritius had an uptick of countries of cases which were imported when they brought in some people who work in their fishing industries, and they were able to control those cases. We are seeing increases in countries like Zambia of late, for example, Zimbabwe as well. Some of the increase in spread is linked to the easing of the physical distancing measures that had been imposed in the so-called lockdowns. Now the countries have had to open up their economies again, and we are seeing this increase. What we emphasize very strongly is that it's important for countries to scale up and sustain their public health measures to control. Get these out of the capital cities, get out in the provinces where in some countries we've seen geographic spread, and be able to, as we've said together with my colleague, to identify, test, find the contacts of, isolate people who are infected quickly. So one of the key things is that the laboratory results must come back quickly enough for you to be able to act. And then, of course, to provide care and treatment for people. And then most importantly, all of us as individuals must be the ones now to take action. The imposed measures are being released. So people must be very well informed about how to protect themselves and to protect their loved ones and neighbors by wearing a mask properly, not around the chin, not around the mouth, but over the nose consistently, and making sure that we keep up the hand hygiene, washing our hands, and then of course, keeping the physical distance as far as we can, especially when we're out in public to minimize the spread of the virus. These are some of the things that we think are very important. And when we see cases going up in countries after the lockdowns, there needs to be a response. Sometimes it might be necessary to reimpose some of these locally based on what the data is telling the government that they spread here, when there may not be rapid spread all over the country. As far as the the capacity to provide treatment is concerned, I think we are seeing some improvements in the capacity. You know, when this pandemic started, the situation as far as ICU, intensive care unit beds, as far as ventilators was concerned, was extremely worrisome. There were nearly 3,000 ventilators in Africa at the beginning of this. Now we know that there are over 10,000. These are still huge gaps, but at least there is some improvement in that situation. And the more we've understood about this virus, the more we recognize that it is very diverse in how it manifests itself as an illness. And there are huge opportunities for managing certain manifestations early so that people don't progress to the stage where they need intensive care and they need to be put in ventilators. So we have put a lot of emphasis into training virtually. because of the lockdowns, healthcare workers and how to manage this condition. We are following very much all the new knowledge about how this disease manifests itself. And we know that we must take particular care to protect people who are the most vulnerable. So elderly people, people who have pre-existing conditions, this is where we have to put a lot of emphasis in preventing their being infected and in making sure that they're getting good treatment.
Thank you, Dr. Moeti. The next question is to you, Dr. Almandari. What are the long-term healthcare lessons that Africa must draw from this crisis?
Sorry, apologies. Thank you, Mary, for this important question. And in fact, can you hear me, please?
Yes, we can hear you. Go ahead.
Thank you for this important question, Mary. And in fact, there are many, many lessons that I may share few of them. My first message, out of this pandemic, and I'm sure this is applicable not only to Afro, but to EMRO and other regions. First of all, as Moeti mentioned, implementation of public health measures that have been proven very successfully in many, many countries. Like, for example, testing, tracing, isolation, quarantine, wearing masks, doing other, cough protocols, and protecting healthcare providers, and these sort of things. These are very important public health measures and system development elements that are very, very important. My second message is the leadership. In fact, without a very strong, first of all, political and then professional leadership in each individual country, we will not be able to, deal with this pandemic in a very successful manner with less losses, a lot of successes, and in a very short time. So leadership is very important at all levels and on all dimensions, political as well as social and professional. My third message is, community engagement, community members, as Moeti mentioned, without each individual member in the community taking his or her responsibility and role to protect the health of each individual in the region and around the globe, we will not be able to succeed. Even if we have the best resources in each healthcare system, the best hospitals, or the best tracing system, without the active a key important role that each individual play, we will not be able to succeed. So this is my third message. And my fourth message is, we need, yes, we have COVID-19 now. It has taken a lot of our attention for the last 6 months. I think now it is our time to go and give attention to other healthcare services. There are many patients who have been suffering for the last 6 months because of unintentional ignorance, yes, but they were not given that much enough attention, because of cancellation of operations, for example, locking of hospitals or cancellation of clinics. So essential services are very important. And at the heart of these essential services, I must say, like, for example, immunization programs, services given to the pregnant mothers and vulnerable groups. So that is my fourth message. And last but not least, this is a new disease, a new pandemic. Day by day, we are learning a lot about it, either the disease, the virus itself, the disease dynamics, the virus dynamics, the disease features, as well as the diagnostic and therapeutic modalities. So sharing of information on a very trustful, very transparent manner within the country, between the countries, and between the regions as well as the organization is very, very important. Otherwise, we will be lacking a lot of information that will definitely misguide us later on when we want to deal with this pandemic in a very successful manner. So thank you very much. Back to you, Mary.
Thank you, Dr. Almandari. So we have another question from Kara Anna. Dr. Moeti can start and Dr. Almandari can complement. What is the estimate of the true number of corona cases across the African continent so far? Dr. Moeti.
Yes, thank you for that question. I mean, I think we've already shared the figure of the number of cases that have been reported on the continent, which is almost 890,000. We recognize that with the challenges that countries have faced in having access to particularly test kits on the global market, we know that African countries on the whole have tested at a lower rate than at the international level, for example. That there is no doubt about that. And we recognize also that it's highly probable that some asymptomatic cases and some early cases with mild symptoms have probably been missed, because in the main, people have been tested when they have presented with illness at a health facility, or mainly people who've been traveling across borders have been tested as well. But what we've observed is that as countries have obtained more testing materials, have had more capacity, and they've increased their testing, and to some extent have gone out to do what is more active case finding, screening people who are not symptomatic. There's been in a number of countries, for example, in Botswana, in Ethiopia, in Gabon, in Ghana, and Rwanda, an increase in the number of cases that are reported. But it's not an increase that has been proportionate to the degree to which the testing was increased. So we think that there is a certain level of underestimation, but we actually do not think that there is a silent epidemic. There are many multiple times than we are having reported people who are infected and people are dying silently somewhere. Certainly in some countries when they have done testing of community deaths, they have found some of them had COVID-19. So no doubt, not only the cases, but also some of the deaths are underestimated. It's difficult to give an estimate in terms of a number, a figure. But what we'd like to say is to recognize some degree of underreporting of the true situation. But we don't believe that there is a silent, huge pandemic going and killing many people in Africa. And what we are striving very much, of course, to help the countries to acquire more material for testing, and also to use a combination of the rapid tests and the PCR so that we can have a more accurate appreciation of the situation.
Thank you, Dr. Moeti. Dr. Almandari, do you want to compliment? We can't hear you. Can you unmute, please?
Yeah, sorry.
Thank you.
Yeah. In fact, I may just add some statistics about IMRO. So far, until yesterday, we have reported around 1,500,000 cases from IMRO, all over the 22 countries, which represent 10% of the global, contribution. Around 80% of these cases have recovered, which is around 1,200,000 cases, which is a good sign. Deaths, we are approaching 40,000 deaths, which represent maybe 4% of the global death. We were just observing for the last, I may say, 3 to 4 weeks, the trend of the cases here in IMRO. And we have noticed there is some sort of overall drop and decrease in the number of the cases if we take IMRO as a whole. Although some countries have reported an increase in the number of the reported cases. For death, it is almost stable, I must say overall. In some countries, it has decreased, while in some other countries, it has increased. So we are observing the situation very carefully, and we are, sending the same message to member states, to authorities, as well as to the communities, to what have been mentioned earlier, when it comes into following the public health measures, the social measures, strengthening the healthcare system, and the responsibility, the whole government and communities have to take, and complementing each other. So thank you. Back to you.
Thank you, Dr. Almandari. So we have a question from Pamela Kumba from Canal Afrique. The first question will go to Dr. Moeti first, and then Dr. Almandari will answer the second question. Have traditional medicines been completely disregarded in the research for solution against COVID-19? To you, Dr. Moeti.
Okay, merci beaucoup, Mary. Merci beaucoup, Madame Pamela Kumba, qui a posé cette question en français. Je vais demander quand même que mon collègue, le docteur Michel Yao, réponde à cette question. Son français est beaucoup mieux que la mienne. Michel, est-ce que vous pouvez répondre à cette question?
Merci beaucoup. L'Afrique, en fait, l'OMS n'a pas écarté la possibilité d'utiliser des médicaments traditionnels. Mais cette utilisation doit obéir à des règles scientifiques. On doit s'assurer que le médicament est inoffensif pour la santé humaine. On doit aussi s'assurer de l'efficacité de ce médicament, que ce médicament, comparé à d'autres traitements ou au non-traitement, fait une différence énorme. C'est cette méthodologie qui est malheureusement pas maîtrisée dans l'utilisation des médicaments traditionnels pour lesquels l'OMS est prête à apporter un appui. Si nous nous référons au cas de Madagascar, nous sommes en ce moment en train de supporter des essais cliniques sur certains médicaments qui ont été mis de l'avant. Le monde entier est à la recherche d'une solution et aucune solution ne doit être écartée, mais ces solutions doivent suivre une méthodologie scientifique pour montrer l'efficacité et l'innocuité des médicaments qui pourraient être mis en avant.
Thank you, Dr. Michel. The second question goes to you, Dr. Almandari. Preventive measures such as wearing of masks seems to be ineffective. Do you have other recommendations?
Sorry, Mary, the question is directed to me?
Yes, to you, Dr. Almandari. Second question from Pamela. Preventive measures such as wearing of masks seems to be ineffective. Do you have other recommendations?
Thank you for this question. And in fact, I must say, it is, I tend to disagree with this sort of statement. Wearing mask is effective, is very effective if it is taken plus other public health measures, like for example, keeping physical distancing or social distancing, washing hands, avoiding, mass gatherings, going to the healthcare facility whenever we feel, we have flu-like symptoms, in order to be tested, to be given the right care, once needed. So alone, I agree with you. It may not be effective, but definitely with these collective public health measures, it is very effective and it saves a lot of lives, when it comes into the truth, proven, scientifically speaking, public health measures. Thank you. Over. Back to you, ma'am.
Thank you, Dr. Almandari. So this second question is still coming back to you. It's a question on Somalia from Sarah. She's asking, can you please talk about the challenges in responding to COVID-19 in Somalia? Back to you, Dr. Almandari.
Thank you very much for this question. As we all know, Somalia is one of the countries in Africa, as well as under IMRO, WHO supervision, that have been suffering from protracted emergency and conflicts. This has led into a lot of weakening in the system as a whole, but mainly and specifically in the healthcare system. And also this sort of protracted emergency has led into weakening the health status of the community members in terms of their capabilities to stand strong against whatever diseases, especially infectious diseases. So with these challenges, weak healthcare system, weak community members, health status, and lack of funds, I must say, inaccessibility sometimes to some of the difficult places, have led into a lot of challenges, facing WHO in specific when it comes into, working on healthcare programs, but other UN agencies who are supporting directly or indirectly WHO in running its programs. But in spite of that, the country office there, the WHO country office, in strong partnership and collaboration with the health authorities in the country and UN agencies, donors, They managed, to mobilize resources. They managed to do a lot of training to the national healthcare staff. They managed to provide a lot of supplies, either PPEs, diagnostic, therapeutic, as well as equipments and machines. We are following up the situation there directly with the Minister of Health, as well as the country support team that have been created in the regional office is working closely with their counterpart in the Ministry of Health through the country office on regular meetings, looking at the trend of the disease. There is a lot to say about it. We have done a lot, but still, as you said, the challenge is really huge and a lot to be done. And I'm sure, inshallah, we can do a lot in that country and many other countries facing similar challenges. Thank you, Mary. Back to you.
Thank you, Dr. Al-Mandari. So if you are just joining us, we are doing a press briefing right now on the COVID-19 response in Africa. And we have the two regional directors, Dr. Moeti and Dr. Al-Mandari, as well as Dr. Michelle Yao. So if you have your questions, send it to the Q&A. Tell us your name and the news media you represent. The next question is to you, Dr. Moeti. This question is from Susan Janji from AFP. Countries like South Africa have reported historically higher than normal deaths from natural causes. Do you think there could be much higher COVID-19 deaths than what is officially reported across Africa?
Yes, thank you for that question. As I said previously, we recognize that there is underreporting of cases and possibly underreporting of deaths as well. And we have understood that the South African Medical Research Council has reported an increase of deaths from natural causes that would have been reported for a similar period last year. And there's a question being raised of whether or not this discrepancy is linked with COVID-19 related deaths, which are not reported as such. And this is something that we think merits looking into. But as Dr. Al-Mandari has already said, that we are seeing at the same time as countries needing to respond to the COVID-19 pandemic, the fact that other diseases, other conditions and illnesses are being disadvantaged in terms of people getting access to treatment for various reasons. To some extent, people are afraid to go to health facilities because they fear that they may then be mixing with people who have COVID-19 and be infected. And we know that this has happened in some cases. Secondly, the attention of the National Health Services, the capacities have very much been turned to responding to the pandemic. And then thirdly, the fact that there were lockdowns, people couldn't move around very easily, also limited access to healthcare services. And we have had reports of a significant decrease in access to certain services, for example, access to antiretroviral therapy by people who have this chronic disease, access to tuberculosis treatment, immunization by children, family planning by women, and even the use of safe delivery services by pregnant mothers. So women who are going to deliver safely in health facilities have reduced, meaning that probably more deliveries at home at higher risk. So we expect that there would be a certain degree of people who have died simply because they have not been able to reach the services for one reason or another caused by the COVID-19 pandemic. That is why we are emphasizing very, very strongly the need to continue at the same time as the response to the pandemic to provide essential services to people and to make people aware that these services are available, to of course make the health delivery system safe in terms of infection prevention and control, both for healthcare workers and for patients. To make sure that there is what we call triaging, separating, trying to identify those who are likely to have COVID-19 and separate them from other people. And then also, we are promoting the possibility of scheduling services in certain ways so that you don't have people crowding in clinics or in hospital waiting rooms, waiting to be seen, and where it's possible, outreach services so that go to people's homes, where healthcare workers who are properly protected can provide the service. This is very important, we feel, because we are concerned that in the end, we may see more damage from other illnesses and conditions than we will from people dying from COVID-19 itself, and countries have to do both.
Thank you, Dr. Moeti. We have a question from Tama Khan from Business Day, and this question will be answered by Dr. Michelle Yao. What is WHO's assessment of the rate of false negatives for SARS-CoV-2 PCR testing, and what are the implications for managing the diseases? Over to you, Dr.
Yeah, thank you very much, Mary. It's quite a difficult question, and it's difficult to estimate. The question has a different scope. False negative mean that maybe somebody having the symptoms and not being tested positive. A negative test can be seen mainly using the PCR when the person is at the earlier stage. If you are tested a few days before the symptoms or before being sick and asymptomatic, then the test could be negative. If it tests also like 3 weeks after the symptoms, the positivity also is reducing. People test at the end of the disease can be tested also negative. But people really sick is unlikely using PCR to if it's practiced according to the protocol, to have a false negative. As impact, when you are negative in the PCR, it could be at the earlier stage, it could be at the end of the outbreak, so you are unlikely to transmit the disease. The risk is reduced. I mean, the test PCR is the golden standard. We still have limitation with the rapid diagnostic tests. Some of them are testing later using the antibodies. Some of them are using the antigen of the virus, but all of them have major limitation, some limitation compared to the PCR. Is why we are advising countries to enter in a kind of study to see this limitation so that they can complement the PCR approach and testing people based on different purpose. The serology testing wider to see where the disease is going, but in case of diagnostic, relying more on PCR while working to improve the quality of the rapid diagnostic tests.
Okay, thank you, Dr. Michelle. Our next question is coming to you, Dr. Almandari. This question is from Bukola Adebayo from CNN. She's asking, with 1 million cases, Africa's corona numbers are still very few. What factors are responsible? Is it a delayed outbreak or governments are not testing enough? Dr. Almandari, please.
Thank you, Mary, and thank you for this important question. And if you don't mind, I just may refer it to Dr. Moeti because, she is covering. We are, here in IMRO, we are covering only 7 countries in Africa, and Dr. Moeti is covering most of the countries. So if you don't mind, I'll just refer it back to you, Moeti. Is it okay? And if there is anything that I may add, I will do, inshallah.
Okay. We think there are many factors that might be accounting for the low numbers of cases. Certainly, the virus arrived in Africa later than it did in Europe and in Asia. And the first cases in Africa were imported cases mainly from European countries. And then at the beginning, we saw a very slow evolution in terms of the increase in the number of cases. And one thing that did happen relatively quickly is that in quite a few countries, as soon as they started having cases, I think African countries benefited from having been sensitized by what was being done in Asian countries and what started to be being done in European countries. They imposed the lockdowns and physical distancing measures very early. So at the very early stage of having a small number of cases, I think having realized that the public health capacities in terms of testing capacity, for example, isolation facilities were relatively limited. They're working very hard to expand this capacity to control through public health measures the spread of the virus. So they imposed these physical distancing measures, and this imposition we have acknowledged many times came at a huge cost economically for the countries. And this bought some time for the countries to now scale up, increase and decentralize the testing. Testing certainly has been increased. It's not yet where it needs to be, but it's very, very different from the situation late in February when we started to see the virus here. So these are some of the reasons we think. So the early action of the governments in imposing these lockdown measures. In addition, we wonder whether it could be something to do with the structure of the population, because we have understood that there is evidence that people below the age of 20 can be infected at lower rates than people who are older. And certainly we have a very youthful population in African countries that could be a factor. We are continuing to try to analyze what could be other factors that are instrumental in Africa having experienced a lower number of cases. Certainly, we need to be very aware that we are now seeing, and if you take South Africa as an example, one of the issues we believe is also how connected in terms of international travel countries are. If you look at the number of flights that land in many African countries internationally, it is less than you find, say, in European countries or in Asian countries. Certainly, we know that African people do move around. They move even on the ground. There is some degree of cross-border transmission happening. We have seen in the different regions of the continent. So we have to weigh up and analyze all these various measures. We certainly don't believe it's to do with the climate, the fact that it's hot in Africa. We don't think that there is convincing evidence there. And we are very concerned that now that the countries have had to release their measures, we will see increases in cases, as we have seen in some of the countries that, as I mentioned earlier. So this is something that we're continuing to look at understanding. I mean, certainly, as I've said, we need to get the testing up in African countries. We need to increase the testing, and we'll be convinced that we are seeing the correct situation when we see high rates of testing with a positivity at around 5%. This is the case now in relatively few countries. So there's still a lot of work to do to scale up the testing and appreciate the true situation.
Thank you, Dr. Moeti. So we have another question from Nicholas Barrio from Wall Street Journal. This question is coming back to you, Dr. Moeti. What is WHO's view concerning whether there might be a silent pandemic going on in Africa, since it's not easy to tell due to lack of testing capacity?
Thanks, Mary. I think I've already spoken to this question a couple of times, acknowledging that testing has been one of the biggest challenges that African countries have faced because of the poor availability of testing kits on the global market. This is something we're working very hard with the Africa CDC and other partners to help our countries to have access to. And we, however, as I've said, we've seen that as countries increase their testing, we initially do see an increase in the number of cases that are being discovered. So cases being discovered early on, especially when they also adopt case finding strategies that go beyond waiting for somebody to present with symptoms at a health facility. So they discover more and more early cases and asymptomatic cases. But even in a country like South Africa, where we've already said this is the worst affected country on the African continent, now number 5 in the world. As they scaled up their testing, they did not find that they were seeing hugely increased numbers and proportions of tests positive all over the country. There were distinct places. So it is in certain hotspots, if you like, in mainly the big urban agglomerations like Gauteng, the Western Cape, the Eastern Cape, where many people, Eastern Cape is a more rural area, but that is where many people travel to as the Gauteng was being locked down. They did find in some of the other areas relatively low positivity rates, even if they did go out quite aggressively case finding. So we've seen that in other countries as well. As I said, what we'd like to see to be able to really confident that we're seeing the true picture is higher testing rates with positivity rates around 5% or below. Then we'll be satisfied we're seeing the true situation. So conclusion, yes, there is some underestimation. We have seen that in a number of countries that have increased testing, but as we keep saying, we do not think there is a hugely underestimated situation, and we particularly don't think there are, thousands of people dying on the continent undetected. We'd like to be confident, and that's why we are pleading for international solidarity. We are working very hard to find the means to negotiate with companies in order to have the countries have a fair shot at really seeing the real situation through having the testing capacities that they need.
Thank you, Dr. Moeti. So this next question is from Shakira. I'll pass the question to you, and then Dr. Michelle can complement. What is WHO's opinion on the current measures being implemented in South Africa to curb the spread of COVID-19? And is WHO concerned with the COVID-19 numbers coming out of South Africa? What should be prioritized at this point in South Africa to flatten the curve?
Yes. I mean, of course, we are very concerned about the situation in South Africa. It's the worst affected country on the continent, accounting for about almost 2/3 of the cases in the WHO African region. It's way above. So if we look at the numbers, South Africa's numbers are several fold more than the nearest next country's case numbers, cumulative case numbers in the region. We think that the government has taken pretty strong measures. They instituted a national lockdown as very early on in the pandemic. They've also put in place some socioeconomic mitigation measures, which I will mention because we think that it's very important as we are imposing measures that will affect people's livelihoods and their ability to provide food for their families, for example, to provide some support so that people can have either cash transfers. That's what they did in South Africa. They increased some of the allowances that are available for low-income households and vulnerable households to enable them to be able to play their part as individuals in the response. Since then, I think because of the economic impact in common with many countries, South Africa has now started to ease its measures. They are scaling up very rapidly their public health capacities now for testing, for contact tracing, for isolation. What we think they need to be doing more of is decentralizing these capacities. So they're facing a very challenging situation of a rapidly evolving pandemic. At some point, the rate of growth of cases was extremely fast. It's starting to show the first signs of slowing down. They are engaging in community education. As we've said, as these measures are being relaxed, people are being informed and educated to do their part to wear masks. They have now imposed the wearing of masks in public places and need to monitor. We think that one of the most important things is not only to declare that these measures should be taken, but also to be informed, to monitor how these are going to reinforce the type of communication with people. People are needing to behave in ways that are very abnormal for long periods of time. We are seeing to some extent a fatigue, which needs to be addressed in terms of how people are supported to sustain these changes of behavior every time they go out. We've observed that there are many challenges in South Africa around, for example, the proportion of people who have to use public transport to go to work. So some of the support that the government is providing to the taxi industry to enable them to provide the support and to do so in ways that are safe with some degree of physical distancing are very important. So to conclude, we think they are doing the right things. We think the situation is very challenging. We agree that the targeting, using data to focus on the hotspots where the rate of increase of cases and the number of deaths are most intense is absolutely correct. And to combine that with measures to ease opening up of the economy where there is safety. And we think that the most important thing is to be able to be everywhere, be able to have enough capacity where the situation is the worst, and to be able to use data to determine every decision and every action to control that is undertaken. And then, as I said, to really support and enable people to play their part, both with information, and if people are too poor to be able to buy a mask, to provide these things, masks, access to water and soap or sanitizers, and most importantly, if you like, empowering and enabling people to understand these measures, the behaviors that they have to undertake. We also think that, and we see that they are doing the same, there is need to focus on the most vulnerable people in the society, you know, to make sure that people understand. If you have a granny in the house or an elderly uncle, you must then do your part to protect your elderly relative being infected, because they are the ones who are most likely to get severely ill and to perhaps die of the disease.
Thank you, Dr. Moeti. So the next question is from Ferdinand Omondi from BBC. I would like Dr. Almandari to answer, and then Dr. Moeti can complement. So he's talking about the recent video that was online about the issue of hydroxychloroquine. So he wants to know what is WHO's position on the use of hydroxychloroquine as a treatment for COVID-19. So Dr. Almandari, you can start, and Dr. Moeti can complement.
Thank you, Mary. Thank you for this question. In fact, it is, if I may say, $1 million question, you know, but what, as far as I know, based on what we have, you know, came across for the last few weeks, based on the trials that have been conducted by many countries on using this medication, and based on the expert opinion that WHO is coordinating when it comes into the solidarity trials, you know, this medication have been proven by these studies coming from different countries that it is not effective. So WHO has given it is say, and it is opinion on that. The video has been disseminated, I mean, or shared, or have been communicated to many, through many social media channels this week or last week. And what, as far as I know, it has been just, stated on using that medicine on a number of patients, and that person was saying it is very effective, and I have been trying it. So I have nothing, you know, to add and to say, except that WHO has given its statement, it has given its guidance on the use of this medication based on evidence-based, reliable and valid, you know, data shared by countries. So this is what I just wanted to say, and I'm not sure maybe Moeti and colleagues, you know, can add on that. Thank you. Back to you.
Thank you, Dr. Almandari. Dr. Moeti, do you have anything to add?
No, not really. I think Dr. Almandari has said it very clearly. I think all of this must be based on evidence. And yes, I've seen the video that you referred to that went viral. This is highly regrettable. I think one of the things that as doctors and responsible people who have a certain influence of people's beliefs and people's behaviors, we absolutely must be responsible in what we declare, and it must be based on evidence. You can't stand in front of a mic and say you don't need masks because hydrochloroquine is a preventive and a treatment. No. So, I think WHO has indicated what is our view, our advice to people in the world, and I align with that completely.
Thank you, Dr. Moeti. So we have another question from Elizabeth, and I'll pass this question to Dr. Almandari again. What is WHO doing to ensure that a COVID-19 cure or vaccine, when available, will be accessible to countries in Africa?
Thank you, Miriam. This is another important question. And in fact, WHO have been working with many partners, donors, as well as member states and research centers to make sure that these sort of vaccines, whenever they are ready, to be shared with member states, particularly to ensure that countries, low-resource countries, have access to this sort of vaccine. And if we go back to May this year, in which we have had the WHA meeting, the World Health Assembly meeting, in that resolution, it was stated that WHO, in collaboration with other UN agencies, to work and create a system to ensure equitable, fair distribution of the vaccine and access to the vaccine, particularly to countries with low resources. And as far as I remember, and Mayuti can add to that, WHO is coordinating in partnership with other UN agencies and other donors and countries, and it has launched something called Access to COVID-19 Tools. We call it ACT Accelerator. It is a global collaboration, to accelerate the development, production, and equitable access to new COVID-19 diagnostics, therapeutics, and vaccines. And similarly, I think on 3rd of June, the United Nations and the International Red Cross and International Red Crescent movement, they launched a movement. It is called which called for unity to scale up efforts on vaccines. So there is a global momentum, and WHO is at the heart of it with Gavi and other organizations to make sure that these vaccines, whenever ready, are accessible and given and provided to everyone, particularly to countries and communities that are low resourced. So there is some sort of security on this issue. Back to you, Mary. Thank you.
Thank you, Dr. Almandari. So we are getting closer to the end of this media briefing. Apologies to those questions we were unable to answer. We will try to answer them and send them by email or WhatsApp. So we close. I would like to go back to our panelists for their final thoughts on the milestone that we are approaching, 1 million cases in Africa. So Dr. Almandari, you can start, and then Dr. Moyoti will give the final words. Over to you.
Thank you very much, Maria. Again, thank you very much for giving me the chance, of joining you in this important press conference. In fact, I don't have that much to say except, saying that this is a new pandemic in the recent past history. For the last 6 months, we have learned a lot, and we shared a lot, successes, failures, if I may call it, lessons, that we can carry and take with us. 6 months ahead of us, and beyond maybe 6 months, we need to work hard together in a very trustful and respectful manner as individuals, as communities, as countries, as regions, as organizations. Without that, we will not be able to come out of this pandemic, and serve the humankind as a whole, not as individuals or communities or countries. So this is something that is important. And as mentioned here in this press conference, there are certain measures that have been proven either for the last 6 months by some countries and communities whenever they implemented it, or in the past sort of experiences and similar scenarios of similar pandemics. So these measures are very important. We have to follow. My last message is, please, for communities, as you have just mentioned in your question, please avoid, to be misdirected, misinformed, and trapped by the infodemics. People are sending messages here and there. We don't know, intentional or unintentional, but we have to be careful. Please go and seek the right information from the right platforms, from the right sources in your own country to avoid misguided, misinformed, which ultimately leads into wrong decisions and, God forbid, losing lives and causing disabilities. And we have witnessed that recently, when we started this pandemic or dealing with this pandemic. So I'm sure, whatever we do now, it will be remembered by us and our generations. And I have no doubt, inshallah, that we will come out of this together with a very speed sort of manner, with a lot of successes and less, very minimal losses. So thank you very much again, and back to you.
Thank you, Dr. Almandari. Dr. Moeti, your final thoughts, please.
Yes, what I'd like to say is that, as we approach this million cumulative cases milestone, of course, this can be emotionally, psychologically, very daunting, very threatening for us as a continent. But I hope, personally speaking, this, this fires up even more my determination. And I'm sure I speak for all of my staff and all the leaders of the continent, the ministers, their staff, and most importantly, the people that we've had coming up to the first million. I believe African countries have averted a situation that could have been worse through taking some very courageous, very costly public health decisions. Now going forward, we are determined, at least from WHO, and I'm sure the governments are equally determined to continue to do the work now differently through public health interventions, well-informed people, and investing in finding our place to have access to the tools that are going to make such a difference. Particularly here, I'm speaking about the vaccine. So I'd like to just end by reiterating the importance of global solidarity. We talked a lot about access to testing in Africa and how this was compromised by a very distorted global market for some of the key items that would have made the situation easy. We are very much hoping that we do not see a similar situation now when it comes to access to the tools of prevention, access to a vaccine particularly. So I'd like to end by encouraging our African countries to still continue to sign up for the vaccine trials that are going on, to inform the public well about the vaccine. We just following on my colleagues' comments about misinformation, the vaccine denials, misinformation about vaccine, characterizing the vaccination of young girls as ways to sterilize our women for the future. These are not true. So I would like to plead with people that let us as individuals and families play our role in availing ourselves to be vaccinated when this vaccine becomes available so that we change the situation on our continent. And then to the international community, because we are observing higher income countries starting to prepay so that they can secure millions of doses of the vaccine. Just to say that we live in an interconnected world. As long as there is one corner of the world where this disease might spread because of lack of access to the vaccine, it'll find its way into other places in the world. So let us please show this understanding of our common destiny, if you like, the fact that we are so interconnected, and enable African countries who are doing a lot themselves under the leadership of the African Union and through mechanisms established by WHO to work on having access to the vaccine. And like this, we can demonstrate that we are a compassionate world, we are an equitable world, and we can develop all parts of the world despite the threats of things like this pandemic. Thank you.
Thank you very much, Dr. Moeti. So we have come to the end of this press briefing for today. I would like to say a very big thank you to our two regional directors, the Regional Director for Africa, Dr. Matshidiso Moeti, and the Regional Director for Eastern Mediterranean, Dr. Ahmed Almandari, and able Dr. Michelle Yao. Thank you to all the participants, and do have a nice afternoon. Thank you and bye.
Thank you, Mary. Bye.
Thank you.
Thank you. Bye-bye.
Bye-bye.
Bye-bye.